TAVI stands for transcatheter aortic valve implantation. This is a minimally invasive catheter-based procedure for patients with aortic stenosis. Aortic stenosis is a narrowing of one of the main heart valves that can result in breathlessness, chest pain, or even dizziness and loss of consciousness. TAVI is performed by introducing a valve into one of the blood vessels, usually at the top of the leg, in a collapsed form. The valve is advanced over a guide wire into the heart and is expanded in the narrowed valve to replace its function. This can be done either with a balloon or using a self-expanding mechanism. TAVI is suitable for patients with aortic stenosis who are either at high or intermediate risk for open heart surgery. We will normally discuss with you what we think is the best option for you, and for most patients your case will be discussed at a multidisciplinary heart team meeting in order to evaluate which we think is the most appropriate option for you. Before you have your TAVI procedure, you will require a number of investigations. This will include an ECG to assess the heart rhythm, an echocardiogram, which is an ultrasound of the heart, which allows us to assess the valve function as well as the pumping function of the heart. You will also require a CT scan, which is a specialist scan which allows us to assess the heart valve and measure its size and determine which size of valve and which type of valve is best to implant. The CT scan also will look at the blood vessels and allow us to determine whether we can introduce the valve from the leg or whether an alternative access is going to be better. The CT scan also looks at the coronary arteries, and it may well be that you will require coronary angiography if the CT scan suggests that there is significant coronary disease. You will be admitted the day before the procedure, and we will tell you whether you need to stop any medications prior to coming into hospital. The TAVI procedure itself is performed in the cardiac catheter lab, which is an X-ray lab which allows us to see the valve as it is introduced into the body. The TAVI procedure generally lasts between an hour and an hour and a half and is performed under local anaesthetic with you awake or with a small amount of sedation if you are feeling anxious. We will put some local anaesthetic into the skin over at the top of your leg, and we will introduce tubes into the blood vessels, and it's through this which we will introduce the valve and implant it into your heart. You shouldn't feel anything as it passes through your body, though some patients do have a little bit of discomfort, but this is generally short-lived. After the procedure, you will be returned to the ward and you should be able to mobilise within about 4 to 6 hours. We often aim to get patients home the next day, but sometimes it takes a little bit longer. Like any heart operation, TAVI does have some risks, and some of these can include serious complications. Death or stroke can occur in approximately 2 to 3% of patients. In addition, there is a risk of injury to the blood vessel where we introduce the valve at the top of the leg. This can result either in bruising, which occasionally may be excessive, or more extensive bleeding, which may require further intervention or even surgery to repair the blood vessel at the top of your leg. In about 5 to 10% of patients, we need to implant a permanent pacemaker, as the wiring of the heart, which is very close to your aortic valve, can be damaged during the TAVI procedure. Pacemaker implantation is a relatively straightforward local anaesthetic procedure that can generally be performed on the same day or the next day after the TAVI procedure. TAVI valves have a known durability that may be between 5 and 15 years. That means your valve may need to be replaced at some point in the future. Currently, we don't know for sure how long these valves will last, but the vast majority of patients do not require any further intervention. A small number of patients will have a leak around the valve, which we call a paravalvular leak. On occasions, this may require additional intervention, either with further stretching of the valve or even implantation of another valve. The main benefit of TAVI is that the recovery time is much shorter than for open heart surgery. Generally, we would expect you to be up and about after the procedure within 4 to 6 hours, with the potential to be discharged the next day. You may feel a bit sore after the procedure, but we would expect you to return to normal activities within a very short period of time and hope that you would have less symptoms and improved exercise tolerance almost immediately. We will follow you up in about 4 to 6 weeks' time with repeat ECG and echocardiogram to assess the TAVI valve function, though if you have any symptoms in the meantime, we will be happy to see you earlier to evaluate that.